Hello and welcome to Iteniv's webinar on provider productivity after your 8.3 upgrade. We enjoyed the opportunity to meet many of you at UGM this year and hope that you find this webinar interesting and helpful. My name is Chelsea Lukens and I'm the Marketing Communications Coordinator for Iteniv. First, I'd like to take a moment to explain how today's presentation is going to work. First, I'd like to mention that this webinar will be recorded. In just a few minutes, I will introduce Cynthia Kincade, who will share her insights on the 8.3 upgrade and what she has learned on provider productivity after the upgrade. You may ask questions at any time by typing them into the question box on the GoToWebinar control panel. We have set aside time at the end to answer all these questions. Finally, for audio clarity purposes, everyone's phone will remain muted during the entire webinar. Please feel free to use the type and chat in the chat and questions boxes. If there are any audio issues, please let us know in the chat box as well. So without any further delay, let's go ahead and get started. First, I'd like to introduce Cynthia Kincade. She is the Vice President of Client Solutions at Iteniv, worked hand in hand with our beta clients on NextGen and the 8.3 upgrade process. She is recognized as a leader in the industry and has frequently been speakers at both UGM and MGMA. Cindy, I'm going to go ahead and pass the webinar off to you. Please feel free to get started when you're ready.
All right, everyone, thank you for attending. What we're going to be talking about today is the 8.3 overview, common mistakes made when upgrading, lessons learned from past upgrades, setup options, and workflow ideas as we move through and based on experiences. As Chelsea mentioned, Iteniv has been an active participant with NextGen as a development partner, participated in testing for the 8.3 initial rollout, as well as the new usability client group that is facing specific specialties. So now we can move on and just talk about what is driving the move to 8.3. I'm sure everyone knows it's the need to meet meaningful use requirements, the need to be prepared for ICD-10, improved workflow and flexibility, configuration versus customization, the foundation set, and the belief that 8.3 will be so much better than you, and you will have happy providers singing your praises for giving them such a wonderful upgrade. If you have upgraded, how is that working out so far? I think everyone knows that this has been a challenging upgrade, so instead of high fives, are you hearing, it is slow. I don't know where anything is. There are too many clicks. There are too many screens. Why do I have to do this? Whose idea was this anyway? And I hate this. What? You haven't upgraded yet. So many of you have upgraded. However, there are quite a few of you out there that have not. Or if you have upgraded, you just realize that you need yet another KBM upgrade in order to meet the ICD-10 deadline, October 1st, 2015, or to do a 2015 full year of attestation. The relaxation rule allowed us a little bit more time, and it allowed us to move forward, and many of you may have taken advantage of that, particularly if you had not upgraded to 5.8 UD1. However, that did not take away the fact that at this point, there is still a full year of attestation required for meaningful use stage 2 in 2015. There is still time, but the clock is ticking. So how long does it take to upgrade to 8.3? If you haven't upgraded at all, these are the things that you need to consider. There are multiple influences that will affect your timetable, such as current hardware. There are specific requirements for hardware in 8.3. That may be the reason some of you have delayed, or you may not be aware of it. The current database version in KBM, and the available resources for configuration, moving customizations, testing, training, and support. The current database and version in KBM will require how hard it is. If you're on KBM 7.7 or KBM 7.6, it's a much more difficult upgrade than, say, upgrading from KBM 8.1. I get this asked a lot. Does anyone even know what the latest KBM version is? As we all know, and if you've been involved in this, there are hot fixes and upgrades and patches coming out literally weekly in some cases. So the current version in general release as of 11/24/2014 is KBM 83827 Hotfix 4. Since this just came out on 11/24, it's unlikely that many of you on this call have this hotfix. Many of you are also waiting for KBM 8.310. This was the release that the usability committee pulled in and brought in the new specialty content and also worked on workflow for some of the specialties such as ophthalmology, OB-GYN, cardiology. There are several others, and we can talk more about those as we get to the end of the presentation. The beta testing period just changed, so the new beta testing period is now 12/15/2014 to 1/23/2015. Beta client training is basically during that same time frame. Beta production will be on 1/26/2015 to 27, 2015. NextGen has basically allotted time for basically 1 full month, 6 weeks for testing, 6 weeks for testing, and then 1 full month of beta go live prior to bringing it out in general release on 3/9/2015. Hopefully this will vet this particular release out much further than some of the ones that we have been dealing with over the past several months. So why is KBM 8.3 so hard? I want to know. After all, it's only an upgrade. We've all done this before. Everybody on this call, unless you're brand new to it, has upgraded your KBM at some point. Here are some facts about KBM 8.3 that I've learned along the way and many of the clients we've worked with have learned. This is more than an upgrade. This is really a conversion. If you are on KBM 7.7, 7.6, even 8.1, it's a total change in philosophy. There are major changes in workflow. It was designed to accommodate meaningful use too, and that's not a friendly meaningful use requirement. There are a lot of requirements there, and NextGen had to get them in just as all other vendors did, and it was a big challenge. And then, of course, we have ICD-10. As you know, there have been multiple versions and hotfixes, and it's very difficult to know which version to even go live on, and there are continued changes and challenges. I think NextGen acknowledged that at the UGM, and again, those of you who have upgraded are very aware of some of the challenges that have been faced. Those of you who have not, your predecessors have probably worked some of those things out for you, because as with every release, the problems get smaller and smaller, and 8.3.10 is supposed to be a very positive release. 8.3.8 still has some challenges, and we'll talk a little bit more about those as we go through. There are steps you can take to reduce your pain. If you haven't upgraded, learn from those who have. Take the time to plan it out correctly, and don't skip on training. That's where I've seen some of the challenges. It's very difficult to get physicians to participate in training, and again, this is for almost a brand new system. You almost have to treat it net new, so don't skip on your training. If you have upgraded, where does it hurt the most? Start there. Check for newly released versions and hotfixes. There have been many defects corrected since the original 8.3. A lot of clients I work with are either on 8.3.3 or 8.3.5, and that's a challenge. NextGen has worked with a client focus group, and those fixes are going to come into 8.3.10. The biggest challenge that I have, though, is that I'm not going to sit here and pretend on this call that it is easy for some of the larger clients participating to ever be able to upgrade. You've got customization. You may have taken steps to fix some of the challenges you face yourselves, and every upgrade, even a hot fix, has to be tested, so it's not something I take lightly. However, you do need to check where you're at and figure out how you can move forward. Revisit your configurations and evaluate if changes will help. Another thing that we have found as we were going through this is that individuals didn't spend enough time on the configurations. They're so used to customization or not having the options that they really didn't spend as much time on the system practice templates as they could have. And that actually provides a lot of enhancements that can be done without customization. And we'll be chatting a little bit about that as well. Consider additional or follow-up training sessions, lunch and learns, being able to come in and move things forward in a more positive way. Every upgrade is challenging, and the physicians have not received this one well at all. What I'm going to do is give you a tale of two upgrades. These are both actual upgrades, and these are both clients that I tend to have worked with in their upgrade process. They just handled it very differently. So they're both large 100-plus multi-specialty practices. They both were upgrading from KBM version 8.1, which in theory is an easier upgrade. However, it is still a major challenge. Both of them were heavily customized, and that's where their similarities end in the upgrade process. I'm going to start with practice A, somewhere in the USA. I would never tell the name of a practice because this one did not go well at all. They started with limited project planning intentionally. They felt that they could get upgraded and that they would move forward and that they would do everything after the upgrade. Their goal was to just get upgraded. They determined to use KBM 8.3 out of the box. And I think that's a goal that everyone has, but they were very adamant about using it out of the box 100%. They only conducted the technical gap analysis with no workflow gap analysis. So as I mentioned, this particular group was heavily customized. They did the technical gap analysis, so they knew which templates were used and what to do. However, they didn't do a workflow gap analysis to understand if the new KBM 8.3 templates would resolve the current workflow that they were living in. They had limited provider involvement. In fact, it was almost nothing. They conducted webinar training for all providers with no requirement for attendance. Now, we all know that it's practically impossible to get your providers to come to training, but you can at least try. And in this particular case, it was basically webinars with no tracking as to whether they showed up or not. No configuration other than what was mandatory for Go Live with a plan to get to that after Go Live. So again, those system practice templates and all the setup, they felt they would just do what they needed to do, and then they would get provider feedback after the Go Live and implement that post Go Live. They did no schedule reduction, and they had no on-site Go Live support. So, Practice A results. It was a chaotic Go Live with unhappy patients and providers. There has been a continuous loss of provider productivity. They still aren't back up to their numbers, or if in some of the providers that are up to their numbers are not actually documenting in the EHR, so they have not accomplished what they hoped. There is missing data. There are coding errors. And the plan configuration after Go Live has been put on hold as they are just too busy putting out day-to-day fires. Practice B is IU Goshen, and that's Indiana University at Goshen, and I worked with Christine Laws and do have permission to use her as an example or use this practice as an example because it was a very, very big success, as you can be with KBM 8.3. They had a dedicated project manager with a detailed project plan. They desired to move to out of the box, but they weren't 100%. They understood that that may not be the case with some of their specialties or some of the challenges, particularly with this version. They conducted both technical and workflow gap analysis. Based on findings, they conducted configuration when warranted and customization to fill the gaps. They created specialty work groups. They conducted super user training. They enlisted provider champions. They trained, and trained again. And I can't emphasize that enough. The amount of training that went into this particular group was very impressive, and it paid off with the extensive in Go Live. In addition, they had extensive Go Live support. They started out by going with 2 weeks of Go Live support, and by the fact that it had people at every site, and by the end, they were actually able to reduce that because of the advanced planning. The results were there was minimal productivity disruption at Go Live. There were some physicians who obviously didn't like it because, again, the workflow changed in 8.3. That said, they were able to keep their productivity at a perfect level. There was more provider acceptance than I've seen at many of the groups that we've worked with. The Go Live resources reduced faster than expected, and it was classified as a successful Go Live. In addition to that, they provided me with a list of their 8.3 favorite features because with all the challenges of 8.3, there are some very positive functionality. They love the new toggling functionality. They consider it a time saver. They also consider a time saver the capability of being able to see messages in the task basket without opening it. Providers actually stated that this saves some time when trying to answer questions quickly between patients and knowing which things can wait and which should be answered sooner. They like the sub-navigation quick link functionality, which we'll talk about a little bit further in the presentation. Some of the enhanced features they like are system practice configuration options. It decreases the template customization needs. And in their particular case, while they still have customization, it dropped dramatically. They find the health promotion plan positive. They love the homepage medical chart summary. And they save functionality for favorites available on more templates. So the save functionality for favorites available on more templates is a difficult one to say, and we'll be talking about that as well. But that basically gives you the ability to save favorites by provider, and we'll talk more about that as we go through. So let's talk configuration, setup, and features. Items that can be configured in 8.3 are the KBM framework, sub-navigation, EHR documents, common and favorite diagnosis, KBM panel display, lab and radiology order favorites. We'll start with configuration home. Much of the configuration that can be done on the practice level and on the provider level can be done by starting with the system configuration template home. To access the configuration home template, you go to File, System, Practice Templates, and Configuration Home. And we can move on. Configuration Home. What is the Configuration Home template? It's a new navigation for system practice templates, ease of accessing commonly used system practice templates. And what it gives you is that from this Configuration Home, you can do the framework content, manage template links, NG KBM config, Office diagnostics, My Plan order sets, DB pick list setup, document configuration, pick list setup, immunizations, clinical guidelines, template defaults, PEDS development setup, OB education setup, recommended care, and diagnosis groups and reference systems. The framework content, what can be configured? The pill bar, sub-navigation links, reason for visit, physical exam, review of system, medical family history pop-ups, procedures and medical chart summary, all can be configured by specialty, practice, and or provider, making that really powerful. It also allows for configured workflow to meet both practice and provider needs. We'll start with the framework content. This provides the ability to customize tabs and sub-navigation on practice and or provider level. So you can actually go in and put tabs and sub-navigation to show in your workflow, and this allows you to go to the commonly and frequently accessed templates and be able to access them quickly. Sub-navigation can be set up to launch hard-to-find templates. Some of the examples of the setup are shown in the screenshot. I'll give it a second for you to take a look at just some of the examples we've provided. This also gives you the ability to have configurable EHR documents. You can configure documents directly in EHR through practice template NG KBM doc config. These can be configured per provider for chart note, consult note, and referral letters. It certainly doesn't take care of all of the document generation and creation. However, this does give you the ability in certain cases to configure certain documents, taking some of the customization needs away. What are the benefits of configuring the EHR documents in the system practice templates rather than in Document Builder? It gives the ability to customize the following documents on the provider level rather than only at the practice level. So if you think about it, when you're configuring an EHR document in Document Builder, the standard one, what that does is you would have one document, and then you have to link up and do multiple templates if you had separate documents for the provider. In this case, chart note, consult note, and referral letters can all be configured by provider rather than at the practice level. And obviously, there's no Document Builder experience needed to conduct these type of changes. The next area that we've seen a lot of positive feedback is custom common assessments. Common assessments can be configured by specialty for practices to help find commonly used diagnosis. This is something that I've found that when we've looked at sites and we've conducted analysis that is probably not used enough and is relatively easy to set up. And it gives you the ability to help your physicians find your diagnosis, particularly for those groups who are not using IMO. Common assessments can be configured by specialty for the practice to help find commonly used diagnosis. It's configurable in the practice NG KBM diagnosis common assessment template. Specialties will be set up out of the box, but diagnosis can be changed at any time. Many groups just went in with the specialties that were set up and found that that wasn't sufficient, or didn't even realize that it wasn't sufficient and just couldn't understand why the physicians were so unhappy. This is an area that I said that I really believe you can get some very positive, quick wins by working in this area. Continuing on custom common assessments, it helps reduce the need of a diagnosis code lookup, and it makes selecting diagnosis for today's visits much faster. The next area that, again, everybody, even in their most unhappy state, actually is very happy about is the patient information bar. How can the patient information bar be useful? The patient information bar can be used to show a quick snapshot of important patient information, quick access to allergies, problems, diagnosis, and medication modules, the ability to view demographics, insurance, patients, pharmacy, and other providers. All of those areas where you see the items and you see where that you've got the allergies unknown, the problems, in this case diagnosis 1, you can hover over those and actually go to the area. And I think those of you who have upgraded will probably all agree this is one of the nicest things that they did. You also have the ability to access the areas that are highlighted down here in blue to be able to go and actually look at the information and do documentation directly from this bar. You can also move to your telephone template, see alerts, etc. It's really taken NextGen much closer to having a single area where you can actually move from place to place by launching from the patient information bar. Doesn't have everything yet. They're working on it, and I think as you move into NextGen future plans, you'll see that more and more of this technology is going to be used. The patient information bar, you can configure the patient information bar with relevant information for your practice. So the sample that I just set there or shown you was not necessarily how you have to have yours look. You also have the ability to have 3 patient demographic information, 3 custom pop-ups, and 3 custom table fields added to the patient information bar. So you can move it around, make it look the way you want it to, and this is all done in terms of configuration, not customization. Another area are panels in the KBM. Panels are movable and collapsible. I've got mixed feedback on this. I think this is personally a really nice feature. However, I've had others that didn't see this as a huge area. Wanted to mention it because in the case of some of our practices, they absolutely love it, and others want to keep their panels expanded at all times. But basically, it allows for a configurable workflow by user. A lot of individuals don't know that you can do that. They just see the panels as they come out of the box, and you can actually configure them. It effectively decreases scrolling with the ability to collapse all panels. And again, I've got mixed reviews on that. I personally like it. However, I've had some providers say that it's more trouble to collapse them and open them. So that's a personal decision. It is there, and again, the feedback is mixed. The panel order and collapse preferences will be retained by the template when logging on. Again, I'm not sure everyone recognizes that this functionality exists. So therefore, that may be why people aren't seeing it as a positive like I do. The SOAP Quick Note. The benefits of the SOAP Quick Note is that it gives you the ability to save a complete SOAP note and recall it for any patient. This will save everything on the SOAP template except the vital signs. So if you were to save this and create a SOAP template, what would happen is that the next time you had a patient that you wanted to use that on, you would actually be able to bring it up, and all you would have to enter are the vital signs. It allows for major time saving if used properly, and I want to emphasize on that because we're going to speak a little bit more about that. You can quickly recall full documentation on a routine common visit in your practice. So for example, a well woman exam, a pediatric exam, a back-to-school physical, some of the items that have been used, whether it's over and over and there's not a large need for individualized documentation. That's important to note, and with some groups, they don't like this because they feel it promotes cloning. That has to also be a practice decision as to whether to use this functionality, and the good news is it can be secured, so it is a setting that you can have available or not available. Again, used properly, I think it's a great feature, and that's just something that you would have to, in your own internal compliance, really look to and determine whether it's right for your group. Important information about the Quick Note. I probably got ahead of myself. If documentation has already been entered for the patient, applying the Quick Note will override it. That's something that individuals need to be trained on. If you've gone through and you've done half of the documentation, then you go up and you pick the Quick Note, it's going to overwrite what you've already done. If a Quick Note is saved with diagnosis and/or orders, it will automatically order what was previously saved. And if physical exam findings have already been documented, you cannot apply a Quick Note. How to save a Quick Note. You would document everything you would like to save on the SOAP template. Under the pill bar, you would click Save by the Quick Notes section. You would name the Quick Note and then click Add. To recall a Quick Note after it's been saved is you would go to the SOAP template. Under the pill bar, click Apply by the Quick Notes section. Select the desired Quick Note to apply for this patient, and off you go. One of IU Goshen's favorite templates was a checkout template. I also think it's one that's largely underserved and, again, missed by a lot of groups. Did you forget, during the time after your visit, did you forget that any orders that you would like your staff to quickly place for you? It gives you the ability to order any labs, diagnostics, referrals, follow-ups, and others, right at checkout. It's a quick task of any order from the checkout template. My phrases. My phrases, for those of you who were on 8.1, have been around for a bit, even to a certain extent in KBM 7.9. However, they've been greatly expanded in 8.3. My phrases can be used in many ways to streamline your documentation and improve efficiency. They now are saved by the type of my phrase, which will limit the displayed list to relevant my phrases when recalling them. Are there my phrases that you would like to share with other providers? You are able to copy my phrases between providers within the enterprise. Be careful with this one. What seems like a really nice functionality can also sometimes create confusion with some of the providers who are receiving them. So if you are going to copy my phrases between the enterprise, make sure that everyone is aware of it. One of the things that we have done with a lot of the groups that we've worked with is, as you're preparing for your upgrade, being able to come up with the provider committee, come up with some standard my phrases, create them under one person, and then copy them within the enterprise, and then let everyone else have their own individual my phrases in addition to that. Just some thoughts of how to control these, because they can get out of control very quickly. Where can my phrases be used? They can be used on some HPIs, not all of them. They can be used in the patient plan, provider plan, diagnosis impressions, differential diagnosis, telephone calls, and more. They're really pretty prominent throughout the application in KBM 8.3. So how do you create my phrases? Anywhere that you can use my phrases, you click on the Manage My Phrase link. You select the my phrase type, my phrase summary, and the my phrase, and you click Add. Now, it's important to know the my phrase type, because a lot of times what you'll have are providers, so this is an area to train on when we talked about train, and train again. If you're going to let your providers create my phrases, which I strongly recommend, make sure you train them on the my phrase types. Because what will happen is you'll find that they'll go out, they'll create a lot of my phrases, and then they will go to use them and be very frustrated that they've disappeared, because they didn't understand that when they saved them as a certain type, it would not necessarily display, i.e. in the patient plan or in the HPI. So it's very important to save your my phrase type with the proper one so that when you go to use it, you can find it. Provider-specific assessments. NextGen has the ability to create a provider-specific favorite list for diagnosis. This is the new improved ICD-10 diagnosis lookup as they were preparing for ICD-10. This is also an area that will make some of the IMO functionality not necessary because NextGen has added it itself. It makes commonly used diagnosis searching selection process quicker for providers. It gives you the ability to create a favorite diagnosis category. And it allows you to manage the list from the diagnosis code lookup active text on the assessments pop-up. So as you can see, where you go in and you're actually bringing up your diagnosis, you can see how that these favorites will come up, and then you can actually manage them as you're doing the diagnosis. NextGen now has the ability to create favorite lab tests. In the order module, create both practice favorites and user favorites to maximize ordering efficiency for lab and radiology orders. These can be set up for both NextGen Compendium and for each specific lab. We've actually found a lot of functionality for this, being able to do panels. All of you probably use my plan, and that may give you some very positive abilities with panels, but we've also had some groups who wanted to just keep this within the orders module. And what this gives you the ability to do is you can actually create favorites, and so that you can have a series of panels as you move into being able to order and plan for future orders. And just here's some example of practice favorites. So as you can see, you can go in, you can look at the practice favorites. A practice favorite is available for everyone. I think that's obvious. And then user favorites can be individual. We're going to jump into immunizations a little bit. I know immunizations has been a really big challenge in 8.3. We are aware of it, and we actually have another webinar coming up, I believe, next week on immunizations, and that's the total focus of the webinar. However, in this particular case, immunization orders, they made a lot of expansion into immunizations as became part of a meaningful use to requirement. So what you have now is the ability to configure practice-specific immunizations. You are now able to set up administration timelines for each immunization. Each immunization will indicate if it is past due or currently up to date. For Meaningful Use Stage 2, immunization interfaces are now available. You used to have to kind of do it manually with exports and imports and uploads. Now that it's an actual interface. Save and send current and historical immunizations within the same process as lab orders. Again, not a separate functionality. It's all part of your lab ordering. Immunization category functionality. Additional immunization categories can be set up and pushed out at a practice level. The additional immunization categories can be used to easily find and order semi-commonly used immunizations in your office. Immunization categories. How do you set up immunization categories? You open file maintenance. This is a little different because it goes to the EHR file maintenance as opposed to the system practice configuration. You click on Master Files, System, EHR, Practices, and Preferences. Immunization categories. In the Practice Preferences, click on Orders module and select the Immunization tab. In the Favorites category section, click the Norton button and select New. Then you click the folder and select your desired immunizations, and you attach them that way. Where will these immunization categories display in EHR? These will display in the Immunization Order pop-up within the Orders module. Viewing tasks in the inbox. There are more tasks within the EHR that are attaching the commentary directly in the task. So this allows for a quick snapshot of the task to quickly manage them. So now you can have more notes and commentary so that you can see and understand what the task is. And this is greatly improved from the way it was before. I think everybody will agree with that once you get used to it and you've got it set up. The health promotion plan. First of all, what is the health promotion plan? As we move forward with population health, meaningful use, and all of the areas that we're looking to be able to promote good health with our patients, the health promotion plan is a nice addition that they've added to make it easily accessible. As part of meaningful use, you may need to do a health promotion plan for BMI, depression, and or hypertension. I know there are other ones, but those are the most common ones chosen as you're going through and setting up your criteria for meaningful use. This allows you to quickly diagnose, document, an action plan, and order a referral to the necessary specialist. All of that can be done from the patient information. How do you use the health promotion plan? On the SOAP template in the Vital Signs panel, click on the link that says Health Promotion Plan. On the pop-up that launches, document the necessary health promotion plan and click Add. Those are the features that we've highlighted. Those are just to name a few of the things that you can do in KBM 8.3. So whether you are upgrading for the first time or upgrading your upgrade, the bottom line is it's all in the details: planning, configuration, training, and execution. Do you need help in planning your next steps? iTentive can help by providing an EHR workflow assessment. We are currently offering an end-of-year special to conduct a 3-day on-site assessment for $3,750. That includes a workflow analysis, planning, a written report of our findings, and all the travel expenses. So everything's included. This is an end-of-year item that we offer every year. Certainly not any obligation from this webinar. We just wanted to mention it for those of you who may be struggling. We're here to help you if we can. If you have any questions after this upgrade or would like a copy of the slide presentation, you can email me. I'm going to let Chelsea leave this up for a bit, and we will also make sure that we contact and follow up with each of you via an email to let you know this information as well. So for now, I'm going to open it up if there's any questions on the webinar and any questions that I can answer for you as we discussed in the beginning. So Chelsea, you can open it up for questions.
Well, Cindy, I had somebody request if they could get a copy of this presentation. As you just said, Cindy, you can email Cindy for it, and we'd be happy to send it. We're also going to be putting this up on YouTube if you want to watch it again. It'll be on the iTentive YouTube channel within a couple of days here. We'll give you guys a few minutes to type any questions you might have in the question box on the GoToWebinar control panel. Can you think of anything else right now, Cindy, that you want to add while we wait for people to type questions?
Good. We're giving everyone a chance. I hope you've enjoyed it. This is a presentation that we've done before. We are going to be offering multiple webinars coming out. This is going to be something that we are doing regularly. We have some coming up on population health, as I mentioned, immunizations. We're going to be talking about patient portal and minors, and just a number of different things that we'll be sending out promoting just to give people education and maybe answer some of the general questions associated with things as opposed to just looking at how to do it. We will be getting more into the regulatory aspects, and we're looking forward to these. We're very excited to present these webinars.
Another question came in, when is the immunization webinar next week? It's going to be same time, same day, so it's going to be Tuesday at 12 p.m. Eastern Time, 11 a.m. Central Time, and we're going to be sending out an invitation for that here shortly. Another question came in. Where is the patient portal or when is the patient portal for minors and minors webinar? Those are going to be at the beginning of January. So starting, I believe, January 4th, roughly, we're going to be doing one on patient portals and minor usage in them. So keep your eyes out for an email on that. Another question, I joined a bit late, but was wondering how you are training or handling the new problem module in 8.3. Are you training to the templates or to the module? This has been a big pain point with our 8.3 upgrade.
We are actually doing both, depending upon the client preferences. It works both ways. Sometimes it can be accessible. It is a pain point. I acknowledge that. That would be something probably too much detail to get in this. I personally, I really think it varies by practice. That sounds wishy-washy, but I really believe it varies by practice. And if it's a pain point, we probably need to look at alternatives.
And while we're waiting to see if there's any more,
I'd be happy to. And by the way, if anyone wants to email me directly, I'm not opposed to just answering some basic questions. If you certainly want to email me directly with some specifics about your challenges, if I can't answer it, I can find someone who can.
Thanks, Cindy. And I also wanted to mention that on December 10th, which is going to be a Wednesday, 2 weeks from now, we're going to be doing a webinar on population health management as well. So those are our next couple coming up shortly here. We'll stay on for a few more minutes if anybody has questions. Otherwise, as Cindy said, her contact information is up there. Please feel free to reach out to us. We love to help out with this kind of stuff. And thanks so much for joining us on the webinar.
Absolutely. And everyone have a wonderful Thanksgiving holiday.
Yes, happy Thanksgiving. Any specific advice to cardiology, Cindy?
Well, there's a lot of enhancements and improvements coming up in 8.3.10, and there's been a lot of bug fixes. I can tell you that's been one of the specific areas where the most customization has been continued because it just didn't meet their needs. The workflow was not well received. My advice is get on 8.3.10 as quickly as possible, or at least get it into a test environment so that you can see the functionality. As I understand, a lot of improvements have been made. Our focus, we participated in the usability committee, and while I've seen demos of it, I wasn't actually involved in that particular provider committee. I was involved in OB-GYN, and I can tell you how it works. Basically, they've got a number of their clients, not necessarily their larger clients, but some of their most local or challenged clients that are having problems with the new workflow, and they pulled them together. Their focus was on defect fixes as well as providing workflow enhancements, and there was quite a bit done for cardiology. That would be my advice, honestly. If you cannot wait, and I didn't really talk about this. We talked about whether you can, 8.3 and the changes and that kind of thing. If you can wait, if you haven't upgraded at all, you've got a challenge, because in going into 2015, you really do have to have a full year of attestation. Rumor has it that that's going to be changed, although rumors I've heard with CMS don't always come to fruition. I personally think it will. I think you're going to end up being able to do 90 days for Stage 2 in 2015. It's not happened yet. All of it's just theories and what you're hearing when you're out in the industry specialty guides and that kind of thing. For now, it is a full year of attestation. And if you haven't upgraded to 8.3 at all, if you're still on one of the 8.1s and lower, you can't wait for 8.3.10. If you are in a position that you've got a meaningful use certified system for Stage 2, then you really can wait until 8.3.10 or even 8.3.11. Now that they've shifted 8.3.10 to March, that's going to be the one that has significant defect fixes for all specialties, but cardiology in particular. Cardiology, ophthalmology, dermatology, OB-GYN, and whenever I'm trying to repeat these, I always miss one, but there's one additional one that has major changes to, orthopedics. All of those were the focus of the usability in terms of the specialty content itself. There was also work done on primary care, and then defect fixes for all clients. And if any of you were at UGM, you saw what 5.8.2 is going to bring to bear in terms of the workflow and the tasking. There's a lot of positive enhancements coming up. So if you're set for meaningful use and you aren't in total panic for Stage 2, and you can use some of the advice we're giving you here, then hold for a more stable upgrade. If you are not there and they don't suspend the full year attestation, for those of you who can't wait until March, you really need to get started for 8.3 as quickly as possible if you're going to meet those deadlines.
Hey, Cindy, another question. Is our 3-day on-site assessment for provider-specific or clinic workflow?
It's both. It basically is one of our managing consultants who will come out. Again, it's because this is a time of year where there's so many holidays. We offer this up once a year during December, where that we will send one of the managing consultants out. They'll take a look at your workflow processes, your pain points. It's really customized for each group. It's 3 days on site. If they can give immediate advice and make some quick wins, they will do it while they're there. If not, they'll come back, write a report, get it to you with recommendations, many of which you can do yourselves, or you can look for consulting help going forward. It's really up to you. It's not designed to be, an augmentation for sales. Obviously, though, we may come up with some things that we could help you with. The real purpose is to look at your pain points, see how we can help you, and give you some advice on your health of your practice. We also have one for AR as well. So we have our EPM specialist. That wasn't the focus of this one, but we also have one to look at your AR, consult on how you're doing with your revenue cycles, those kind of things. It's just an opportunity to take a look and check your practice.
Another question, Cindy. Do you know KBM will have behavioral health improvements? KBM 837 has many behavioral health issues.
I do not know of any behavioral health focused in 8.3.10. Now, if there were major defects, I'm sure some of them have been resolved. However, there was not an explicit focus on behavioral health. And I am familiar with those issues. It's been a challenge.
Okay, everyone. Well, thank you so much for joining with us today. And as we said, have a safe and happy and healthy holiday.
And as Chelsea said, if you have any questions, feel free to email me if you're having some specific issues that we haven't seen here or discussed here.
Thanks, everyone. Have a great day.
Right. Bye-bye.
Bye.